Chapter 24, Disease of the Urogenital System. So the urogenital system is a combination of the urinary tract or kidneys and the reproductive system. So the urinary tract is the same between male and female, and it includes the kidneys, whose function is to filter the blood, and then the ureter, which is a tube that carries urine from the kidney to the urinary bladder, and the bladder itself, which function is to store the urine. And finally, the urethra, which is the tube that carries urine from the bladder to outside of the body. So because both systems are open to the external environment, this makes them very vulnerable and prone to infections. And some infections are introduced from outside, whereas others infection result from imbalance in the microbiota of the urogenital tract. So the UTI or urinary tract infection are one of the most common bacterial infections worldwide, and sexually transmitted infection or STI also primarily affect the urogenital system. So UTI affect differently male and female because of the difference in the urogenital anatomy. So the urogenital system uses many ways to protect itself from infection. So the mechanical defenses include the flushing action of the urine, which includes the kidneys, the ureter, and the urinary bladder. And the urine passing out of the body washes out transient microorganisms, preventing them from starting an infection. The epithelial cells lining the urogenital tract are also so tightly packed that they provide a particularly effective frontline barrier against invaders. Another way to prevent infection, for example, in the vagina, members of the resident microbiota compete with opportunistic pathogens like the yeast Candida albicans. So this competition prevents infection by limiting the availability of nutrients, thus inhibiting the growth of Candida albicans and keeping its population in check. In addition to the production of lactic acid, mostly by a variety of species of lactobacillus, provide an acidic environment within the vagina that also serve as a defense against infections. The production of acid is actually tightly regulated by the hormone estrogen because it regulates glycogen that is used as a primary source of carbon for the fermentations. I will not describe too much about the glycogen and the estrogen, but this is just FYI. All right. So the other ways to prevent infection is through immunoglobulin A and lysozyme that we have discussed many times in our past lecture. So for an infection to develop, the pathogen must attach to the host cells by using its fimbriae. It has also to be able to replicate inside the cells to avoid detection by the immune system. And very important, urogenital infection can be transmitted to the fetus during pregnancy or birth. So below the bladder, the normal microbiota of the male urogenital system is found primarily within the distal urethra and include bacterial species that are commonly associated with the skin microbiota. In women, the normal microbiota is found within the distal one-third of the urethra and the vagina. Bacterial disease of the urinary tract can affect either the urethra or the bladder or the ureter. And if the disease involves the urethra, the infection is called urethritis. If the disease affects the ureter, the infection is called urethritis. And if the disease affects the bladder, the infection is called cystitis. So the bacterial infection of the vagina are called bacterial vaginosis or BV. So it's the low level of estrogen that are associated with an increased vaginal pH and an increased risk of BV, imbalance in the normal vaginal microbiota without inflammation. Okay, so this BV, sorry, with the inflammation, I'm sorry. So this BV may be asymptomatic and may cause mild symptoms such as a thin or white to yellow homogeneous vaginal discharge, sometimes burning and itching. So the major causative agents is Gardnerella vaginalis. Please remember this microorganism. It's a pleomorphic bacterium. The disease is usually self-limiting, although antibiotics treatment is recommended if the symptoms develop. Lactobacillus Gardnerella vaginalis, it's part of the normal vaginal microbiota, but when the population of lactobacillus decrease and the vaginal pH increase, Gardnerella vaginalis flourish and cause vaginosis by attaching to the vaginal epithelial cells and forming a biofilm. Also, Gardnerella vaginalis also produce a cytotoxin called vaginolysine, that lyses the vaginal epithelial cells and also induce the loss of red blood cells. Okay. So, what else? So the group B streptococcus, also known as GBS, they are bacteria that commonly live in people's gastrointestinal and genital tract and that come and go naturally in the body. Most of the time, the bacteria are not harmful. Sometimes the GBS bacteria can cause urinary tract infections, and usually doctors use a sample of urine to diagnose urinary tract infection by GBS on blood agar plate. And pregnant women can pass the bacteria to their babies during pregnancy or during delivery. To reduce the transmission of the GBS to the newborn, the future mother is administered with antibiotics during labor, and GBS most commonly cause bacteremia, sepsis, pneumonia, and meningitis in newborns. Currently, there is no vaccine to help pregnant women to protect their newborns from GBS bacteria and disease. So cystitis is most often caused by a bacterial infection of the bladder. The common symptoms of cystitis include dysuria, which is the urination accompanied by burning, discomfort, and sometimes pain. And it's also the other symptoms also include the presence of pus in the urine and also the presence of blood in the urine. By the way, does anyone know why women have more chance to develop cystitis compared to male? Actually, in women, bladder infections are more common because the urethra is short and is located in close proximity to the anus, which can result in infection of the urinary tract by fecal bacteria. And these fecal bacteria are gram-negative bacteria such as E. coli, most commonly, Proteus mirabilis, and other Enterobacter species. The diagnosis of cystitis relies on urine analysis. So the urine must be collected without adding more contaminant in the urine samples. So for that, the patients must wash their hands, clean their private with alcohol pads to eliminate the germs, and urinate in a sterile cup. Bacterial cystitis is commonly treated with sulfa drugs, such as the combination of trimethoprim and sulfa drugs. Sometimes we can use also fluoroquinolone and cephalosporin as well. To prevent cystitis, it's usually recommended to always empty your bladder fully when you go to the restroom, and of course to have a good hygiene. As for pyelonephritis, it's an inflammation of the kidney, and it can be caused by bacteria that have spread from other parts of the urinary tract, such as the bladder. So, in other words, an untreated cystitis infection, most commonly E. coli infection, can spread to the kidneys via the ureter and cause pyelonephritis. So, pyelonephritis can also develop from bacteria that travel through the bloodstream to the kidney. So the common signs and symptoms include a back pain due to the location of the kidneys in the back, fever, nausea, and vomiting, and this is associated to the kidneys, usually kidneys inflammation. In 30 to 40 women, percent of women with pyelonephritis, the inflammation of the kidney is associated with hematuria, which is the presence of blood in the urine. So the diagnosis of pyelonephritis can be established by looking at the presence of blood cells and bacteria in the urine, either by direct microscopic observation or by culture. In addition to the culture, sensitivity to certain antibiotics can be very helpful in determining which treatment best fits the patient. So the best way to prevent kidney infection is to drink a lot of liquid and to fully empty the bladder, as I just said earlier. This way you will flush out all the potential pathogens that reside in your bladder and also in your kidneys. And the last prevention is to maintain a high standard of hygiene. Leptospira, they are generally harmless spirochetes. They are commonly found in the soil. However, some are pathogenic and they can cause an infection called leptospirosis in the kidneys and other organs. So leptospirosis can produce fever, headache, chills, vomiting, diarrhea, muscle pain, etc., etc. If the disease continues to progress, infection of the kidney, meninges, and also the liver may occur and may lead to organ failure or meningitis. So when the kidney and the liver become seriously infected, it's called Wells disease. Weils, Wells disease, and the symptoms include jaundice. The cause of leptospirosis is Leptospira interrogans and other Leptospira bacteria species, but mainly interrogans. They have all this kind of the same particular spirochete morphology. They are found widely in animals such as dogs, horses, cattle, pigs, etc., and they are excreted in their urine. That's why it's very important to stay away from dogs and cats when if you are pregnant. Okay? And human generally become infected by also coming into contact with contaminated soil or water. So the bacteria may enter the body through mucous membranes, skin injuries, or by ingestion, something like that. So the treatment for leptospirosis involves broad-spectrum antibiotics such as penicillin and doxycycline. So now we will be talking about bacterial disease of the reproductive system, and for most of them, they are sexually transmitted infection, aka STI, also known as sexually transmitted disease or STD. So many of the infections are asymptomatic, but why STI prevalence is so high is just because many patients do not know they are infected and they do not practice safe sex. That's why. So the inflammation of the prostate is called prostatitis, I'm sorry, and I hope you understood that I'm talking about male disease. The prostate is usually enlarged, and the symptoms are very typical: fever, chills, issues during urination, back pain, I'm sorry, etc. So testing of the urine samples reveal usually the presence of bacteria and white blood cells. And blood samples can also contain bacteria, and the white blood cells count are elevated in the blood, revealing an infection. So when prostatitis becomes chronic, it usually causes intermittent urinary tract infection, which can lead to cystitis. So the diagnosis is made after culturing urine or prostate liquid and semen, SEMEN, for those who don't understand my accent. And they can also be used for diagnosis. So you may have heard of the biological marker at PSA for prostate specific antigen. This is a biological marker that we measure in the blood, and if it's very high, it might suggest a prostate dysfunction or prostate inflammation. So common bacteria that cause acute prostatitis include E. coli. So the infection usually is cured successfully with antibiotics, and the recovery is complete without further complications. So the treatment of chronic prostatitis requires courses of antibiotic administration for 1 to 2 months. Yes, it's very long, and sometimes even longer with low dose, up to sometimes years. So chlamydia infection is a common sexually transmitted infection, STI, in United States caused by the bacterium Chlamydia trachomatis. Please remember that. Again, chlamydia is the most common bacterial STI in the US. So chlamydia is usually found in the form of an elementary body or reticulate body. So the only thing I want you to remember is that the elementary body is basically the non-replicating infectious particle that is released when infected cells rupture. As for the reticulate body is the actively replicating, body of the bacteria. I will now describe the slide. Skip. So about 75% of all women who have a chlamydia infection of the cervix, also known again as cervicitis, they have no symptoms and they do not know that they are infected. So untreated cervix infection can progress to the infection of the uterus and or the ovaries. In men, infection of the urethra, also known as urethritis, is usually symptomatic and it causes a white discharge from the penis with or without pain. So if the urethra infection is left untreated, in this case, it might spread to testicles and cause what we call the epididymitis, which is an infection of the testicles. There are three serotypes of chlamydia trachomatis that can invade and reproduce in regional lymph nodes and cause what we call lymphogranuloma venereum. So this disease is most frequent in gay population and bisexual men because they practice anal sex. That's why. However, chlamydia they can also be passed from an infected mother to her baby during vaginal childbirth and can cause chlamydial ophthalmia. In fact, chlamydia trachomatis accounts for up to 40% of conjunctivitis in neonates in the United States. Chlamydial ophthalmia usually occurs 5 to 14 days after birth, and it may range from mild conjunctivitis with minimal, presence of pus or discharge of pus, and sometimes it can go it can be a little bit more complicated and involve a severe eyelid edema. So the problem with chlamydia infection is that patients are mostly asymptomatic and that the bacterium can hide inside the cells. The diagnosis of chlamydia is relatively simple, and the tests include a urine test, a swab of the discharge from the cervix for women, and a swab of the end of the penis for men. And sometimes both urine and swabs are used for culture or antigen testing for chlamydia. So chlamydia trachomatis infection can be effectively cured with antibiotics once it is detected. So the current guidelines recommend the use of azithromycin among other antibiotics. We can also use erythromycin or amoxicillin for pregnant women. As for newborns, they are systematically treated with eye drops of erythromycin to prevent neonatal ophthalmia. So having chlamydia or having been treated for chlamydia in the past does not prevent you from getting it again. So to prevent getting infected, it is best to avoid infected partners and use precaution. So gonorrhea is a common human STI caused by the bacteria Neisseria gonorrhoeae. The infection is transmitted from one person to another through any type of sex intercourse, and women have higher risk of getting the infection compared to men. Yes, we are not born equally. This gonococcal infection of the urogenital sites are more frequently symptomatic than asymptomatic. However, asymptomatic infection may occur. So the usual symptoms in men are burning with urination and penile discharge. Women, on the other hand, are asymptomatic half of the time, while others have vaginal discharge of pus. They may suffer of pain, they may have abdominal and pelvic pain, etc., etc. So beside the reproductive system, Neisseria gonorrhoeae can also infect different parts of your body. For example, a mother may transmit the gonorrhea bacteria to her newborn during the childbirth, and if it is the case, we always administrate eye drops to the infant. So first of all, remember that Neisseria gonorrhoeae is not considered to be a normal flora under any circumstances. The virulence factors of Neisseria gonorrhoeae are very complicated. They involve protein of the pilus and also protein of the fimbriae, and those proteins are by nature antigenic, meaning that they are used to attach to the cell host and escape the immune system. Sometimes it's very important, something that is very important to remember also is that this protein or those genes that encode for those protein can undergo what we call the gene switching or the antigenic variability. I will not go too much in details, but it's concept that include adaptation. Okay, so basically the protein will change over time, they will mutate and change over time, and this will prevent your immune system from detecting those bacteria over time. So the treatment of gonorrhea for adults usually consists of antibiotics. Due to the drug-resistant Neisseria gonorrhoeae, the CDC recommends that uncomplicated gonorrhea be treated with antibiotics such as ceftriaxone, and this is usually given as an injection. And sometimes the patients are given an oral drug, which is here the azithromycin, another antibiotic. Neonatal ophthalmia are instead treated with bacitracin ointment. As for prevention, it's quite obvious to avoid infected partners and use precaution during sex intercourse. So use this slide just to have a sense of an idea of the shape of the different bacteria and also a summary of the clinical feature, diagnosis, treatment, and prevention. So chlamydia and gonorrhea urogenital infection can progress to a more severe infection that involves the female pelvis and can cause most of the PID. PID stands for pelvic inflammatory disease. So those PID can also be caused by other infectious agents like virus, fungi, but PIDs by definition is the inflammation of the uterus, the fallopian tubes, and or the ovaries. PID should be treated immediately to avoid serious complications like scarring and adhesion of the fallopian tubes, which can cause infertility, ectopic pregnancy, and chronic pelvic pain. We will see in the next slide how infertility occurs in the context of a PID. So PID can be sometimes asymptomatic or present with acute symptoms. So asymptomatic infections should be treated as well, since they can still cause permanent damage of the reproductive tract. So the symptoms usually include fever, abdominal pain, unusual discharge, etc. There are different tests that can be used to diagnose such PIDs, and we use basically ultrasound and sometimes just laboratory test for STI. So the treatment of most PID is the same as the one for chlamydia and Neisseria gonorrhoeae infection. So the bacterial infection causes the inflammation of the fallopian tubes here. If the inflammation is not promptly treated, it can cause scarring of the fallopian tubes, which might block the entry of the spermatozoids or the exit of the fertilized ovule. In both situations, PID will lead to irreversible infertility due to the scarring. If the scar tissue prevent the fertilized eggs from making its way through the fallopian tubes to the implant in the uterus, this could result in the ectopic pregnancy that we also know as tubal, T-U-B-A-L, tubal pregnancy. In this case, the fetus of an ectopic pregnancy is typically not viable because the fallopian tubes do not provide enough blood and nutrient and oxygen for the fetus. So syphilis is an STI. It's caused by the spirochete bacterium Treponema pallidum. Remember that syphilis is transmissible by sexual intercourse, but also by kissing and through close skin-to-skin contact. So the signs and symptoms of syphilis vary depending on which of the 4 stages are present. So the primary syphilis is typically acquired by direct sexual contact with the infectious lesion of another person. On infected person, it appears at the site of infection a single firm, kind of painless, and also not non-itchy skin ulceration, also called chancre, C-H-A-N-C-R-E, chancre, that I will show you in the next picture. As for the secondary syphilis, it shows itself with a diffuse rash that frequently involve the palm of the hands and the soles of the feet, like shown in the picture in the next slide. So this stage So the secondary syphilis of this stage of the disease is extremely contagious. Other symptoms may include also fever, sore headache, weight loss, etc., etc. As far as the latent syphilis, this one displays little to no symptoms. If syphilis is left untreated for many years, it can result in neurosyphilis, also called tertiary syphilis, that can cause neurological and cardiac symptoms. So tertiary syphilis can also progress to skin and or bone disease. In this case, a tumor-like growth that we call gumma, G-U-M-M-A. This kind of tumor-like growth usually appears on the skin. And again, you will see a picture of a gumma on the next slide. So syphilis usually is transmitted during pregnancy from a mother to her fetus through the placenta, and actually approximately 40% of the babies born to women with untreated syphilis can be stillborn or die from the infection as a newborn. And babies born with congenital syphilis can have bone damage, enlarged liver, infection of the liver, jaundice, nerve problems, and blindness, sometimes deafness, meningitis, etc., etc. So in this slide, you will see the guma, the chancre, the rash on the skin, on the palm of the hand, or the sole of the feet. So the pathogenesis of syphilis infection mainly relies on the host inflammatory response. The diagnosis is symptomatic, then it's confirmed by blood tests or observation of spirochetes under the microscope. The syphilis can be effectively treated with antibiotics, and especially the intramuscular penicillin. In case of neurosyphilis, another type of penicillin is given intravenously, so IV. So on the next slide, we will be focusing on viral disease of the reproductive system. And as this one, for this infection, we cannot use antibiotics. So it's going to be a little bit more like challenging to treat this kind of infection. So genital warts is a highly contagious sexual transmitted disease caused by some subtypes of human papillomavirus or HPV. It is spread through direct skin-to-skin contact during sexual intercourse with an infected partner. So the symptoms of genital warts are very obvious. The warts rise above the skin surface, and they can be visible in men and women if they are on the external part of the genital organ, or they can be sometimes hidden inside the vagina in women. So sometimes the warts are so small or they are internal that they can go unnoticed, and the virus can spread to the partner without knowing. HPV 6 and 11 are responsible for 90% of genital warts cases, while HPV 16 and 18 are associated with cervical cancer. There is an easy way to diagnose very small genital warts is by using vinegar solution or acetic acid that we apply directly to the suspected HPV infected genital area that turns white. A pap smear is another way. It's also called pap test. It's preferred as acetic acid, and it cannot be used. And it can be used in an area that are not particularly easy to reach. So a pap smear is a procedure to test cervical cancer in women. Pap smear is basically a vaginal smear that involves collecting cells from the cervix, and the pap test may be combined with another test that we call PCR. Okay. The majority of genital warts disappear without treatment, but sometimes, eventually, they develop a small raised growth. By the way, there is no cure for HPV, but there are methods to treat visible warts which could reduce the infectivity, such as surgical excision. For vaccination, you may have heard of Gardasil. It's sold by Merck, the company. It's a vaccine that protects against HPV 16, 18, 6, and 11, and more than that. The type 6 and 11 again cause genital warts, while the serotype 16 and 18 can cause cervical cancer. So the vaccine is only preventive, it's not therapeutic, and it must be given before exposure to the virus type to be effective. Ideally, before the beginning, ideally would say before someone becomes sexually mature. Herpes genitalis or genital herpes. It refers to a genital infection by HSV 1 and 2. HSV stands for herpes simplex virus. So HSV is usually asymptomatic in the majority of cases, which aids contagions, of course, or the spread of the disease. If it's symptomatic, the typical manifestation of primary HSV 1 and 2 genital infection is itching, pain, blister, ulcer, etc., etc. So herpes virus can stay dormant for some times and reactivate. So if you had genital herpes once in your life, you might develop the disease again. If a woman with genital herpes has virus present in the birth canal during delivery, HSV can be spread to the infant, causing neonatal herpes, a serious and sometimes fatal, lethal condition. But the risk of spreading the infection to your baby is extremely small. Herpes can also be spread to the baby in the first weeks of life if the baby is kissed by someone with an active cold sore. The pathogenesis. So HSV virus is able to suppress the whole cell immune response and subsequent evade the immune system via at least two ways. And I'm not going to go too much in detail, but the HSV protein, they actually are produced in the early stage of the infection and they suppress the whole cell response. Another type of protein that we call glycoprotein C, this one binds to the complement system and inhibits the antibody action. As for the diagnosis goes, most of the time herpes tests are prescribed to symptomatic patients or to whoever thinks he or she might be exposed to the virus. So the test is either based on a ELISA assay using a blood sample or on a PCR. As for the as far as the treatment goes, there is no cure for herpes, but there are antiviral medication that can prevent outbreaks and also reduce the likelihood of transmission to partners. So molluscum contagiosum is an infection caused by a pox virus. The infection is usually a benign, mild skin disease characterized by lesions, growth on your skin that may appear anywhere on your body. So the infection may occur anywhere again on your body, including the genital area. So the virus that causes the pox virus that can be spread from direct contact person to person or through contaminated fomites. So again, the pox virus typically resolve within 6 to 12 months without scarring, but it may take as long as 4 years. So because the infection is self-limited, the treatment may be unnecessary. So HPV warts usually appear as a small bump or a group of bumps in the genital area. They are flesh colored and can be flat or look bumpy, like cauliflower. But remember, some genital warts are so small or they are internal and they cannot be seen. Herpes blister, the middle picture, they look similar to small bumps or pimples before developing into pus-filled blisters. This may be red, yellow, and sometimes white. As far as the molluscum contagiosum, those lesions they are small, they raise, and usually white, pink, and they have this kind of like pit in the center, like volcano, and they are usually smooth and firm and have this pearly appearance. So HIV stands for human immunodeficiency virus, and the infection caused the oh my goodness, acquired immunodeficiency syndromes, aka AIDS. We will see later why this infection caused the gradual degeneration of the body immune system. So HIV is what? It's a retrovirus that primarily infect components of the human immune system, such as CD4 helper T cells, but not only. They can also affect macrophages and dendritic cells. So those two cells are APC. Okay, so this virus directly or and indirectly destroy your CD4 T cells. Okay, So during the initial HIV infection, the patient may experience a brief period of influenza-like illness. This is typically followed by a prolonged period without symptoms, so asymptomatic. So how HIV is transmitted? Usually is via unprotected sexual intercourse, contaminated blood transfusion, needles, hypodermic needles, and from mother to child during the pregnancy, delivery, and also during breastfeeding. So some body fluid, such as saliva and tears, do not transmit HIV. So you're safe if you have a partner that is HIV positive. As the illness progresses, it interferes more and more with the immune system, making people much more likely to get infections, including opportunistic infections and tumors that do not usually affect people with working immune system or active immune system. So the progression of HIV infection has been described by the World Health Organization or WHO and also by the CDC based on the CD4 cell count and also based on the appearance of symptoms. So basically there are 3 to 4 stages. I will not describe them in detail. They are named stage 1, 2, 3, and 4. Okay, and they are all based on the CD4 count in your blood. So these tables and the next ones kind of like summarize all the opportunistic infection that an AIDS patient can be affected with, and most of the time these are fungal infections that affect the lungs. So remember that the HIV virus utilize your own receptor present on the plasma membrane of your CD4 helper T cells. And this receptor is actually the CXCR4 and the CXCR7 and a co-receptor named also CD4. So the virus again use your own receptors to attack your own T cells, replicate inside, and usually, not usually, most of the time, integrate in your chromosome, become a provirus, stay there for many years, usually up to 20 to 30 years, reactivate and start to lyse your own T cells. That's why on stage 3 or 4 that you see a CD4 count dropping dramatically. So the blood tests are the most common way to diagnose HIV. So these tests are usually ELISA tests, and people exposed to the virus should get tested immediately. The early testing is crucial with HIV. You want to be tested before the virus has time to integrate in your chromosome. But because it may take up to 6 months to develop antibodies to the virus, it's important to get tested again the same virus over this period of time if the first test was negative. So when the ELISA test is positive, it's confirmed by a test called Western blot, which detects the presence of viral protein in your blood. If you remember what Derek has presented during this group presentation, you're supposed to know what a Western blot is now. One of the symptoms that systematically put a patient in a high risk of being infected by HIV is the very low CD4 count, usually less than 200 cells per microliter, and one of the AIDS defining illness. So these patients are diagnosed for HIV regardless of their history. There is no vaccine, no cure against for HIV. However, antiretroviral treatment exists. So the current treatment for HIV consists of a combination of at least 3 medication or 3 therapy. And these 3 medications belong to at least 2 types of classes of antiretroviral agents, also known as highly active antiretroviral therapy or HAART. So this treatment can slow down the course of the disease and may lead to a near normal life expectancy because it reduces the risk of death and complication from the disease. However, these medications are expensive and they may be associated with side effects. So basically the treatment consists of 2 reverse transcriptase inhibitors and 1 protease inhibitor. So in addition to this three therapy, patients are also treated for opportunistic infections. So there's something that we already discussed, and then this is the table that I mentioned earlier. The problem here is that patients quickly develop drug resistance pathogens because of the long duration of the treatment. So prevention of the HIV infections primarily through safe sex and needle exchange programs is a key strategy to control the spread of the disease. I will not describe this slide and the coming ones. So now let's talk about fungal and protozoan disease of the reproductive system. So why is so difficult to treat fungal and protozoan disease without causing host cell damage is because fungal and protozoan microorganisms are eukaryote and therefore they share many common cellular systems with the human cells. So the genus Candida is the only fungal pathogen that affects the urogenital system, and Candida species are commonly found in the normal and healthy microbiota of the skin, gastrointestinal tract, respiratory system, and also of the female urogenital tract. There are at least 20 Candida species, and Candida albicans is one of the most commonly responsible for fungal and vulvovaginitis, meaning that infection of the vulva, VULVA, and the vagina as well. So the infection of the vagina by Candida is also described as vaginal candidiasis because it involved the Candida albicans, and this is also known as yeast infection. So as we discussed at the beginning of this lecture, the lactobacillus in the vagina inhibit the growth of other organisms, and these include bacteria and candida or yeast. And this happens especially by producing an acidic environment and by competing for space and food. When the balance of lactobacillus is disrupted, it's what we call again dysbiosis, it can allow Candida albicans or species to increase in number. Okay, so it is this increase in number that will lead to candidiasis, the infection of the vagina. How this happens? Typically, these follow antibiotic therapy, long duration of antibiotic therapy. Sometimes, diabetes can be a risk factor, pregnancy as well, the presence of transient microbes as well, or the immunosuppression can also play a role. And for example, the severe, immunosuppression associated with HIV infection often allow Candida to thrive. Believe it or not, but tight clothing can also, and especially tight underwears can also promote the yeast infection. So when a yeast infection develops, inflammation occurs along with symptoms such as itching. For example, the presence of white or yellow discharge that look like a little bit like cottage cheese. Okay, they appear like curd-like. Other symptoms such as burning sensation during urination can also be indicative of vaginal infection. The diagnosis is mainly symptomatic and can be confirmed by using microscopic evaluation of the vaginal secretion to determine whether there is an excess of Candida albicans after staining the sample with the mighty gram stain technique. Here in the picture, on the right picture, you will see a vaginal secretion stain with gram staining. Remember that Candida is dimorphic, so it means that it exists in a single cell yeast form, but also as a multicellular fungus, also called hyphae. On the left side, in the left picture, the diagnosis can also be established by the presence of these white curd-like colonies in the vagina. So remember that Candida species are naturally found in the normal microbiota. So the culture approach is kind of like useless. So the treatment of yeast infection is based on the use of topical antifungal medication that includes a lot of drugs that ends with azole, A-Z-O-L-E. So one example would be, I don't know, miconazole, or another one that I can think of is the clotrimazole. So a lot of drugs that ends with azole, azole, are actually antifungal medication. So to prevent again yeast infection, the best would be to avoid hot tubs and also long antibiotic therapy. Sorry. So as for protozoan infection, there is only one major protozoan species that cause infections of the urogenital system, and it's the flagellated protozoan Trichomonas vaginalis. So, and this Trichomonas vaginalis cause a disease or infection that we call in science trichomoniasis, that we commonly call trich or trich, Trich. So this infection is the most common non-viral STI. So Trichomonas vaginalis is commonly found in the normal microbiota of the vagina and other with along with other vaginal pathogen, and it can cause vaginitis where when there is a disruption of the normal microbiota, while in main it's usually asymptomatic. So the infection with Trichomonas increase the risk of transmitting or acquiring HIV and is associated with pregnancy complications such as preterm birth. So the diagnosis is established by looking for the protozoa in samples such as the urine, the vaginal or the endocervical specimens for women, and the urine and the urethral swabs for men. So the recommended treatment for trichomoniasis is again an antifungal, anything that ends with an azole, azole, and also another way to to treat is to treat your partners actually. Obviously, to prevent the spread of the infection, it's recommended to use condoms. So this is the last slide of my lecture today, and again, this slide, summarize the content of this lecture with the name of the different pathogens involved in the UTI or STDs, and also the location of this pathogen in this urogenital tract apparatus.